Hi, I'm Nicole from the Note Ninjas. Together with Stephanie, we are a PT and OT duo helping other therapists with documentation tips and treatment ideas. So today, we're going to go over a technique for one-handed dressing. So we get this question a lot, and we just wanted to show you for ourselves what we do. So I have a t-shirt here. We're going to pretend that my right arm is affected. So I'm going to leave this arm right here. I'm going to set up the t-shirt on my lap. Okay. And what you want to do, using the left non-affected arm, I'm going to start threading my arm through. Okay. And I'm going to start to pull it up, but not all the way. And then what I want to do is go in with my left arm. And then I'm going to thread the shirt up past my elbow on both sides. And then I'm going to lift this up over my head and then pull it down. Okay, so that's how you don a shirt. Okay, so to doff the shirt now, what I'm going to do is reach with my strong side behind my head. Okay, and you want to make sure that your patient is seated, supported, especially if they have poor sitting balance. Maybe sitting on the bed might not be the best thing for them to start with. Maybe they can sit in a chair with arms, or that you're guarding so that they do not fall over. Because once we do this, our vision is going to be occluded for a slight few minutes. So what I'm going to do is have the patient make sure that they're supported or that you are guarding them. They're going to reach back, the strong arm, looking down and pulling overhead. Okay. And then what you can do is thread on the weaker side. Okay. And then just kind of wiggle it out. And that's how you doff and don a shirt with one hand. So I hope this tip helped. And if you have any other questions, feel free to reach out to the Note Ninjas. We are here to help you with documentation and treatment planning.